Good morning. This is Jim Walsh, acting mayor for the city of Gardner. We're here this morning to provide an update and some what we hope is helpful information to our community in response to the risks associated with the spread of the COVID-19 virus. I have here with me this morning Lauren Saunders, who is our Board of Health Director, as well as the agent for the board. In addition, we have Dr. Michele Parker, who will be providing some valuable information about the current state of the virus here in Gardner and what we can do to minimize our risk of exposure. So to get started, I'll ask Lauren Saunders if she can join us for a few minutes. Thank you.
Okay. All right, everybody. Thanks for tuning in. Basically, I just want to start by saying that the COVID-19 virus is very rapidly evolving. So these stats I'm about to read you, they're stats for right now. They're going to change frequently, so just keep that in mind. So as of yesterday, Thursday, March 19th, at 4 p.m., there were 328 positive cases in Massachusetts. So that was a 72 uptick from the day before, 72 more patients than the day previously. 14 of these cases in Worcester County. So a reason for this uptick is because there are more tests being done on a local level. So we will start to see more cases on a daily basis. So this is a virus that spreads quickly, as I'm sure you guys know. So also last week the state was testing probably about 200 a day, and now we're up to 400. So that's a good thing. We're moving in the right direction as far as testing. So hospital level support at this time is mostly for your high-risk patients. So higher risk is ages 60 of above and people with underlying health conditions such as cancer, heart disease, lung disease, diabetes, hypertension, and more. To reduce the spread of the disease, the Baker administration has put in place social distancing, which I'm sure you guys have heard all about. So that means trying to keep a social distance from anyone surrounding you of about 6 feet. That's really important. Another important thing to keep in mind is proper hand washing. Hand washing properly for at least 20 seconds or more will definitely help reduce the spread of the disease. So social distancing, hand washing, very important. So I just wanted to touch base on what we're doing locally, like as a department and on a city level. We are working very closely with other boards of health in our area, the Montechusett Public Health Network. It's a network of communities around us. There's 13 of us, so we all communicate regarding what's going on in the area. We're also on daily conference calls with the Department of Public Health, with MEMA, so that's Massachusetts Emergency Management Association, the Environmental Health Safety Agency, and many other organizations. We're really staying as up to date and with all this information as possible so we can then relay it to you guys in the community. For the most up-to-date information, we're looking at mass.gov, and it's /coronavirus 2019, or no, excuse me, COVID 2019. So it's a really good site in addition to the CDC website. So we're also very fortunate, as you know, to see daily updates from Wynn Brown at Haywood Hospital. He's really been keeping the community up to date with what's going on. In addition to that, like I said, like Mayor Walsh said, we have Dr. Parker here today, and she's really going to touch base on the symptoms and kind of how to, prevent the spread and go into more detail on that. Thank you.
Thank you, Lauren. I'm Dr. Michele Parker. I am a primary care doctor in Gardner, Massachusetts. I'm happy to be helping out the Board of Health with this pandemic, and I want people to understand that it is a changing target. Every day there's new information that comes out, and even things like testing criteria will change over time. Most of my patients are calling with really specific questions about things. I'll go over a couple of those with you. The big thing to understand is about the transmission of this virus. It is what we call a novel coronavirus. It means it's a brand new virus. It's never been in human beings before. It just showed up on the scene. So we don't have antibodies to it, and that means there's no vaccine yet, although there is testing. It will be a while. We don't have any specific treatment for it, but a lot of things are being tried experimentally. But that it's especially important that we protect our really fragile members of our community, are elderly over 60, people with chronic illnesses, heart or lung disease, cancer treatment, and immunocompromised for any reason. So those are the folks that will be most affected by this, but it's up to all of us to prevent the transmission. And most recently, there's been a couple cases where it appears that people can transmit this virus even before the symptoms show up. And that is a game changer, because most of the time with flu, we tell people you're most contagious at the onset of your symptoms. However, with this virus, it's quite sneaky. It may be shedding or transmitting in aerosol droplets, which are very tiny particles in the air, or bigger droplets, which when you cough or sneeze can get onto surfaces and last for a long time. So we should try to stay home as much as possible. If we have to go out to the grocery store or the pharmacy, be specific about what you need. Stand a good 3 to 6 feet away from people, even in line. Try not to touch your face. And hand sanitize or wash your hands as soon as you leave, before you go in and before you go out. This is the way we will keep it from spreading and slow the onslaught of cases. Because if people show up sick all in one big wave, it will overwhelm hospitals. It'll overwhelm our healthcare force. Like nurses can get sick, and then we are at a loss for people to take care of the sick. So we are ahead of the curve right now. We're trying to keep all that at a minimum, and so far so good. We do not have a single positive case at Haywood Hospital. You will find if you go there, you are screened at the door. There's only one entrance. And if you are sick, we recommend that you do not come directly to the hospital, but try to call your PCP first for guidance. If you do need to be seen and you're sick, you can go to the Haywood Urgent Care or Tully Walk-In. They have specific criteria in place for triaging people to be tested or not tested. There's a sick corridor and a well corridor, so we're trying to keep the well people separated from the sick people. So at those two locations, Haywood Urgent Care and Tully Walk-In, you can't just drive up and be tested in a tent. You have to be seen by someone, and they will help you decide if you should be tested or not. So a lot of questions about the testing, and there are specific criteria. You can look on the website for the Mass Department of Public Health. It's on mass.gov, and if you just Google PUI, which is Persons Under Investigation, it will tell you the 8 criteria to be tested. I can give you an overview, which is travel to 5 high-risk countries like China, Japan, Korea, Italy, and Iran. But now there's 3 areas of the United States that are considered higher risk, which is Seattle and certain counties of New York and California. That's one piece of the criteria. You also have to have symptoms, which is a fever over 100 and either cough or shortness of breath. There are other criteria for healthcare workers or people in congregate living situations like nursing homes and shelters and prison workers. So please look at the criteria. It may be changing on a regular basis, but right now those are the people we are testing, and you can also call your PCP for guidance on that. People are asking, what do I do if I'm sick or someone in my family is sick or being tested, like you're waiting for your results to come back? There's very specific guidance on how to self-isolate or self-quarantine, and that can be found on the CDC website at cdc.gov. And if you Google guidance and spread, those 2 words, it will bring you directly to the page that tells you, it's a 4-page document on how to protect yourselves at home. It means trying to stay in separate rooms and separate bathrooms, what things to disinfect, not to share things like utensils and food items. So there's a lot of information for you online or through your PCP's office. You should be able to get some of those questions answered. The biggest one I hear is, should I wear a mask and gloves if I go out? That is actually shown not to be beneficial unless you are sick. The sick person absolutely should wear a mask. It prevents the droplets from spreading. But when well people wear a mask, you actually end up touching your face more, which is not a good thing, and it doesn't provide a lot of prevention of the transmission into your system. So we are not encouraging everyone to wear masks. We are saving masks for the sickest people and healthcare workers. So you may be offered a mask when you show up and you say you are sick. You will be given a mask to help prevent the droplets from coming out of you. So the idea of gloves is similar. You put on the gloves, but if you're touching surfaces and then you touch your face, you have the same kind of transmission as if you had no gloves on. So your healthcare providers will be wearing gloves. They will be wearing specific masks called N95 that prevents the droplets from coming in. But for the average person, there's really no benefit to wearing gloves and a mask if you are well. But what you should be doing is practicing your social distancing. 6 feet apart. Try to cough into your elbow, do not touch your face, and wash your hands frequently. So that's our best words of advice for where we're at right now, and I want to thank you for the opportunity to share some of this with everyone, and I'm going to hand things back to the mayor.
Thank you, Dr. Parker, for that valuable information. What I'd like to do at this time briefly is provide some updates as to the status of state operations that we've been alerted to, as well as efforts that the city is taking on a local level to respond to mitigating or limiting the risk of exposure to the public as well as to people who are employed by the city. And to integrate into that the idea that we want to try to maintain municipal services as best we can under these current circumstances. On March 10th, Governor Charlie Baker declared a state of emergency, giving the administration more flexibility to respond to the coronavirus outbreak. The administration continues to take steps to limit the spread of COVID-19. The governor's office, along with the Department of Public Health, continue to make the necessary changes and adjustments to fight the potential spread of the virus. Below are some of them. On March 18th, the Department of Public Health issued an order regarding the sharing of critical information with our first responders at the fire and police departments. On March 15th, Governor Baker issued an emergency order limiting gatherings to 25 individuals and prohibiting on-premise consumption of food and drink at bars and restaurants beginning on March 17th. On March 15th, the elementary and secondary school operations here in the city of Gardner have been suspended, or were suspended for a period of 3 weeks, and that may possibly be subject to change as circumstances warrant. On March 15th, the Department of Public Health issued visitor restrictions regarding hospital and assisted living visitor restrictions. On March 12th, the nursing home restrictive visitor access was implemented. On March 12th, the governor issued a emergency order that modified the open meeting law that applies to notice and participation in public meetings such as we have here in Gardner. These modifications include how many people need to be present as a quorum to participate in the meeting. They involve changes in what we can do to have remote participation in public meetings so that the operations of municipal government that require such public meetings can be assisted and be ongoing as we respond to the needs of the public. At a local level, the city has a website dedicated to our response to the coronavirus emergency, and it's dedicated to keeping citizens updated with the most current information available. For example, food service for all Gardner Public Schools is up and running. Due to a delay in coordination, there was a change in hours, but meals are now available Monday through Friday from 9:30 a.m. to 12:30 p.m. These meals are free for all students regardless of lunch status. Please share this update to ensure that it reaches all of the families who may be affected by it. Also, at the local level, we're trying to maintain municipal services as best we can under these circumstances. City Hall is currently closed to the public, but all of the departments in City Hall are available by email, by telephone, and through our online services. These emails and telephones are available at our website, which is www.gardner-ma.gov, and you can reach all departments through our central telephone number of 978-632-1900. You'll find on our website that many services are available online. These include payments of taxes, both excise and real property. Permit applications are available through the online services. And we also have, for people who want to drop off at City Hall, payments or other communications, we have a lockbox just outside the main entrance of City Hall that is available for that purpose. The police department here in Gardner is fully operational, as is the fire department, although the fire department headquarters is currently closed to the public. The building department and fire department have suspended inspections except in emergency circumstances. You can call, if you feel you have one, please call them during business hours and they will respond to emergency situations on a case-by-case basis. But I want to emphasize that permit applications and the issuance of permits can be done through the online service through our city website. Our parks and playgrounds remain open, but the use of the facilities, including equipment and playground equipment and so forth, has been prohibited. We're not in a position to be able to sanitize those surfaces on a meaningful way, in a meaningful way, and as a result, there'll be signage put up, if it isn't already, that prohibits the use of those facilities in order to minimize any potential exposure that people might have by reason of their usage. So we encourage people to continue to get outside, but at the same time be responsible in accordance with the guidelines suggested by Dr. Parker. And but the usage of the equipment, for the reasons I've explained, is now prohibited for the time being. The senior center, as most people already know, has been closed to the public until further notice, but information for seniors is available at their on their telephone line, which is available through the website, and questions can be answered through them. Haywood Library is currently closed to the public until further notice. I can announce, based upon information provided by the State Unemployment Office, that for those affected by job losses associated with the outbreak and the closures that have been ordered, Governor Baker has eased the rules for unemployment compensation. There is no longer a requirement of a one-week waiting period. So you can get more information at the unemployment website at mass.gov. A lot of people have asked questions about what the status is of our special election to fill the vacancy that exists in the office of mayor. As I trust you all know, I serve currently as the acting mayor until such time as the vacancy created by the resignation of former Mayor Hawk is filled. The preliminary election for the 4 people who currently are candidates is scheduled for April 7th, 2020, and the final election is scheduled for May 5th, 2020. We've received information from the House and Senate in Boston that the legislature will be considering emergency legislation to address possible postponement of these elections, and they'll be considering that, we understand, early next week, and we'll do our best to keep people informed of what the impact of those legislative changes might be. So that concludes the remarks that I wanted to provide as far as the current status of our situation here in Gardner. I want to encourage people to check our dedicated COVID-19 webpage on the city's website at gardner-ma.gov. In addition to other health-related updates that are available through the Henry Haywood Hospital at haywood.org, through the Massachusetts Department of Public Health, which is located at mass.gov/DPH, and you can get their COVID-19 link from that location, and from the Center for Disease Control, which has the most current information available on a nationwide and international basis. So that concludes our presentation for now. I want to thank Dr. Parker and Lauren for their presentations this morning. Please follow safety and sanitizing recommendations and be safe. Thank you very much.